So good morning to all of you. Good morning. I'll start. So welcome back to this mixed bag for FMGE. MCQs as well as visuals. So we call it as a mixed bag. I'm Dr. Pradeep Pawar, Professor of Anatomy, teaching anatomy for the undergraduates and postgraduates since a long period of time. Okay, we'll start with the first MCQ. Good morning, good morning. Good morning to all of you. Have a look at this MCQ. Think and answer. First you answer, then we'll discuss. Yes, come on. Anyone? Okay, I'll start. A 50-year-old male comes to the clinic with loss of taste sensations. On examination, loss of taste sensations. You tell me, the moment this loss of taste sensation comes to your mind, the tongue is divided into anterior 2/3, posterior 1/3, and the posterior most part. Fine. So now you tell me, who supplies the anterior 2/3 taste sensations? Come on students, answer. Whatever you know, you answer. Even if it is wrong, it's okay. Do not retract your messages. You answer, that's fine. So who supplies taste sensations to the anterior 2/3 of the tongue? Anyone? Come on students, be interactive. Taste sensations to the anterior 2/3 is supplied by chorda tympani. The chorda tympani nerve is a branch of facial. Chorda tympani is a branch of facial nerve, right? The posterior 1/3, who supplies taste sensations? Glossopharyngeal nerve, glossopharyngeal. And the posterior most part of the tongue, who supplies taste sensations? I want a specific answer. Posterior most part of the tongue. Yes, it's internal laryngeal nerve. Very good. Internal laryngeal nerve. Internal laryngeal, which is a branch of superior laryngeal nerve, which is a branch of vagus. You should be very specific, right? So anterior 2/3, chorda tympani. Posterior 1/3, glossopharyngeal. Posterior most part is internal laryngeal nerve. It's a branch of superior laryngeal, branch of vagus. Fine. So now, a 50-year-old male comes to the clinic with loss of taste sensations. So now we know sensations were not felt on the anterior 2/3 of the tongue. Sensations not felt on the anterior 2/3 of the tongue. So which nerve is that? Chorda tympani. So that's chorda tympani. And now we know, bacho, chorda tympani is a branch of which nerve? Facial nerve. Given in middle ear. Given in the middle ear. Lesion of facial nerve was suspected. One of the following statements about this nerve is true. Means one of the following statements about the facial nerve is true. Look, supplies the stapedius muscle. Kya bolte ho? True or false? Just tell me, true or false, T or F. Supplies the stapedius muscle. Answer. Facial nerve supplies the stapedius muscle, yes or no? Yes, it does supply the stapedius muscle. Facial nerve is a nerve of which pharyngeal arch. Second. Facial nerve is a nerve of second pharyngeal arch. So all the muscles which are derived from the second pharyngeal arch would be supplied by whom? Facial nerve, correct? All the muscles derived from second pharyngeal arch would be supplied by facial nerve. Which are the muscles derived from the second pharyngeal arch? So whatever is possible, whatever comes in my way, children, I'll tell you. Okay, so quickly tell me, which are the muscles of the second pharyngeal arch? One are the muscles of facial expressions. Muscles of facial expression. Students, again I'm telling you, look, there are two sets of muscles in the face. One is the muscle of facial expression. The second one are the muscles of mastication. Muscles of mastication. No confusion. Huh? Muscles of mastication are 4: temporalis, masseter, medial and lateral pterygoid. And the muscles of mastication are derived from first pharyngeal arch. The nerve supplying the muscles of mastication is mandibular nerve. First arch, mandibular nerve. अब जो भी बाकी है, the rest all are the muscles of facial expressions. And these muscles of facial expressions are derived from the second arch. Nerve is facial nerve. Facial. So which muscles is the facial nerve supply? One is the muscles of facial expression. Second is in the ear. Stapedius. Third. Anything? Third. Stylohyoid. And fourth, posterior belly of digastric. So you get MCQs on this also. Be clear about this. Posterior belly of digastric. So these are the muscles derived from second pharyngeal arch, which are supplied by facial nerve. Okay, coming back to the MCQ. Anything left? और कुछ बाकी है? नहीं. Stapedius, stylohyoid and the posterior belly of digastric. Okay, I'll come back to the slide. Okay, so now supplies the stapedius muscle. Correct? Stapedius muscle is derived from the second pharyngeal arch. Nerve, the second arch is facial nerve. The facial nerve therefore supplies the stapedius muscle. True. Done. It's perfect. Attached to the brain stem at the pontomedullary junction. क्या बोलते हो? What do you say, students? What do you say? True or false? Just tell me true or false. Attached to the brainstem at the pontomedullary junction. These are MCQs in itself. Huh? ये सब एक MCQs है for you. So understand everything very well. So attached to the pontomedullary junction. True. That's true. If you see, I'll draw the brainstem for you. What is this going to be? That's the midbrain. That's the midbrain. That's the pons. Midbrain. That's the pons here. And what is this going to be? Medulla. That's a medulla. Yes. Tell me, students, what is this elevation in the medulla? Anyone? What is this elevation in the medulla known as? कोई बोल सकता है? This elevation in the medulla is known as pyramids. The next elevation in the medulla. Anyone? What is this elevation in the medulla known as? Olives. And the third elevation in the medulla is known as the inferior cerebellar peduncle. Inferior cerebellar peduncle. What view is this? Ventral view. Ventral or anterior view. Ventral or anterior. So this is the midbrain, that's the pons, that's the medulla. And what is this attached to the pons? This is the middle cerebellar peduncle. Middle cerebellar peduncle. What is this part of the midbrain? इसे हम बोलते हैं crus cerebri. Crus cerebri. This is the middle cerebellar peduncle. अब ये clear है ना? I need not label this for you. No, this is the pyramids, this is the olives, and that's the inferior cerebellar peduncle. I'm just telling you the attachment of cranial nerves to the brainstem. Attachment of cranial nerves. Come on, students, if you can answer this. Which are the cranial nerves attached to the brainstem? Okay, tell me, which is this nerve which is attached to the midbrain? Your answer, which is this nerve which is emerging from the ventral aspect of the midbrain? Anyone? Which is this nerve which arises from the ventral aspect of the midbrain? That's the third nerve. This is the nerve which arises from the dorsal aspect of the midbrain. From the dorsal aspect. Who's that? Dorsal. Ventral se third nerve hai bacha. From the dorsal, this is the fourth nerve. Okay, from the dorsal aspect is the fourth one. So what I want you to understand, students, there are two nerves which emerge from the midbrain. One is the third nerve and the other one is the fourth nerve. Third and fourth nerve are attached to the midbrain. I'm just telling you the attachment of cranial nerves. इनके nucleus अंदर होता है. The nucleus is located inside the brainstem. Inside. Okay. All the nerves emerge from the ventral aspect of the brainstem except anyone. All the nerves emerge from the ventral aspect of the brainstem except trochlear. Very good. Trochlear nerve. And the trochlear nerve is the only nerve which emerges from dorsal aspect. Okay. So this is third. This is fourth. Here, this is a very important MCQ for you. The nerve attached at the junction of pons with the middle cerebellar peduncle. Anyone? The nerve attached at the junction of the pons with the middle cerebellar peduncle is Fifth nerve. Nerve attached at the junction of pons with the middle cerebellar peduncle is the fifth nerve. What is this now? That's a pons. That's a medulla. नहीं, pons with the middle cerebellar peduncle, fifth nerve. ये बहुत specific है, बहुत specific. This is a very important MCQ. Clear है, MCQ है. The nerve attached at the junction of pons with the middle cerebellar peduncle. That's fifth nerve. Now, at the pontomedullary junction, there are three nerves. तीन nerves होते हैं at the pontomedullary junction. Sixth, eighth, and this is the seventh nerve. Sixth, seventh, and eighth nerve. There are three nerves attached to the pontomedullary junction. Six, this is six, this is seven, and this is eight nerve. Sixth, seventh, and eighth. And remember, बच्चों, कैसे याद रखोगे आप? The motor nerves are the most medial. सबसे medially placed are the motor nerves, and the most lateral are the sensory nerves. Sensory nerves are the most laterally placed, and the motor nerves are the most medially placed. So which is this nerve at the pontomedullary junction? Sixth. Sixth is purely motor, so that is medial. Which is the most lateral nerve at the pontomedullary junction? That's the eighth nerve. That's a purely sensory nerve. ऐसे याद रखना है आपको, ठीक है? So motor nerves are the most medial, sensory nerves are the most lateral, and बीच में कौन है? Facial nerve. And see students, if you can understand this, facial nerve has got two roots. One is this in blue that I've drawn, and one is this in green that I've drawn. Anyone? Sorry, ये green है, हाँ? Anyone? Can you tell me what is this green and what is this blue? Anyone? What is this green and what is this blue root for the facial nerve? ये दो different. Why have I drawn them different? This is the motor root and this is the sensory root of facial nerve. Sensory root and motor root of facial nerve. Okay, clear to all of you? The motor root of facial nerve, the sensory root of facial nerve is also known as nervous intermedius, or this is known as the nerve of Wrisberg. The sensory root of facial nerve is known as nervus intermedius or the nerve of Wrisberg. एक बोल सकते हो, where does this motor root of facial nerve comes from? Anyone? Students, can you quickly tell me, ये जो motor root of facial nerve है ना, which nucleus of facial nerve does it emerge from? Anyone? Very good. The motor root of facial nerve arises from which nucleus? बच्चों बोलो. Answer. The motor root of facial nerve arises from the motor nucleus of facial nerve. नहीं, dorsal nucleus नहीं. It's the motor nucleus of facial nerve, and this motor nucleus of facial nerve is going to supply the muscles derived from second pharyngeal arch. Clear? Dorsal nucleus of vagus नहीं, बच्चा. We are talking about facial nerve. No, we are talking about facial nerve. So where does the motor root of facial nerve emerge from? It arises from the motor nucleus of facial nerve. This arises from motor nucleus of facial nerve. And where is this located? In the pons. ये pons में होता है. And where does the sensory root arise from? Anyone? The sensory root of facial nerve arises from the superior salivatory nucleus. Superior salivatory nucleus and lacrimatory nucleus. ठीक है बच्चों? The sensory root arises from the superior salivatory nucleus, and what is this going to supply? The superior salivatory and the lacrimatory nucleus are going to supply all the glands of head and neck. It supplies all the glands of head and neck except anyone? Except which gland? The facial nerve does not supply in the head and neck. Supplies all the glands of head and neck except parotid. Very good. अब clear है बच्चों आपको? Is this clear to all of you? So facial nerve के दो roots होते हैं. One is the motor root of facial nerve, the other one is the sensory root of facial nerve. The motor root is medially placed, the sensory root is laterally placed. The motor root of facial nerve arises from the motor nucleus of facial nerve, which is going to supply the muscles of second pharyngeal arch. The sensory root of facial nerve arises from the superior salivatory and the lacrimatory nucleus. And this is going to supply all the glands except parotid. Perfect hai, perfect hai. So from the midbrain, two nerves arise, the third and the fourth. The nerve attached at the junction of pons with the middle cerebellar peduncle is fifth nerve. At the pontomedullary junction, three nerves are attached, 6th, 7th, 8th, medial to lateral, 6th, 7th, 8th. Next, at the junction, in between the olives and the inferior cerebellar peduncle, there are three nerves attached. What is this? 9th, 10th, and the cranial accessory. Between the olives and the inferior cerebellar peduncle, three nerves are attached, 9th, 10th, and cranial accessory. And between the pyramids and the olives, which nerve is that? 12th nerve. Okay, so between the olives and inferior cerebellar peduncle, 9th, 10th, 11th cranial nerves, and between the pyramids and the olives, the 12th nerve. Is this clear, bachcho? So I have told you the entire cranial nerve. See, look students, every option that I have given in the MCQ is an MCQ itself. So if you understand one MCQ with 4 options, you nearly understand 6-7 MCQs. Understand? So be clear about everything. So that's it. Attached to the pontomedullary junction. I'll come back to the original slide. Look. So supplies the stapedius muscle. Yes. Attached to the brainstem at the pontomedullary junction. Yes. Is a content of parotid gland. क्या बोलते हो? Is the facial nerve a content of parotid? अच्छा, one of the following statements about this nerve is false, huh? It should be false. One of the following statements about this nerve is false, हाँ. ये थोड़ा सा गलत हो गया. Yes. One of the following statements about this nerve is false. हाँ. So supplies the stapedius, correct. So it is attached to the brainstem at the pontomedullary junction, correct. It is a content of parotid. What do you say, bachcho? Is it a content of parotid gland? Hare, facial nerve lies inside the parotid, bacha. Facial nerve lies inside the parotid. Correct? Yes, that's correct. Absolutely correct. Which are the contents of the parotid gland? There are 3 contents of the parotid gland. सबसे superficial कौन है? Facial nerve. Second is the retromandibular vein, and the deepest one is external carotid artery. So clear, contents of parotid gland, सबसे superficial is the facial nerve, second is the retromandibular vein, and the deepest is the external carotid artery. So yes, facial nerve is a content of the parotid gland. कैसे ही आता है parotid gland में? I'll quickly tell you. Facial nerve, tell me. Facial nerve, so it's a content of the parotid, that's correct. I'll tell you, one moment. Contains no special visceral afferent fibers. What do you say? Contains no special visceral afferent, that is false. So which is false out of all this? C. Contains no special visceral afferent fibers. अब ये क्या होता है? That I'll tell you. What is the special visceral afferent fibers? If you understand this now, you understand the complete facial nerve. Chalo students, you tell me, what is the facial nerve supply? I will tell you the component of the nucleus, and this component will have its own nucleus. We'll start like this. I'll make it easy for you. What is the facial nerve supply? 1. Facial nerve supplies the muscles of second pharyngeal arch. So 1, it supplies the muscles of the second pharyngeal arch. I'll write it like this for you. It supplies the muscles of second pharyngeal arch. Ab bolo, what is the name of the component which should be there in the nucleus of facial nerve to supply the muscles of second pharyngeal arch? Students, वो कौन सा component होता है which supplies the muscles of the pharyngeal arches which the facial nerve should have? Anyone? What is the name of the component of the facial nerve? It nahi, general nahi bacha, general nahi. It's the special visceral efferent component. Special visceral efferent जनरल ग्लैंड्स को सप्लाई करता है. जनरल विसरल इफरेंट सप्लाइज द ग्लैंड्स बच्चों. इट्स द स्पेशल विसरल efferent, and this component is going to supply the muscles derived from the pharyngeal arches. Okay, so that's special visceral efferent, and the nucleus belonging to this component is motor nucleus of facial nerve. The nucleus belonging to this component is motor nucleus of facial nerve. This is how you have to remember. कोई भी nerve है ना, in general remember it like this. What is the nerve supply? फिर उसका functional component and उसका nucleus. That's easy. Second, what else is the facial nerve supply? All the glands. है ना? It supplies all the glands except parotid. All the glands except parotid. Tell me the name of the functional component to supply the glands. Students, name of the functional component to supply the glands. General visceral efferent. General visceral efferent. ये है general visceral efferent component. ये component क्या supply करता है? Glands. And what is the name of the nucleus of the facial nerve? That's the superior salivatory nucleus and lacrimatory nucleus. Superior salivatory nucleus and lacrimatory nucleus. What else is the facial nerve supply? Students, what else is the facial nerve supply? Supplies the tongue. Chordae tympani, and it supplies special sensations to the tongue. So it supplies special sensations. Yes. To anterior 2/3 of the tongue. Special sensations to the anterior 2/3 of the tongue. What is the name of the component? Students, what is the name of the component which is going to supply the special sensations to the tongue, or which is going to carry special sensations from the anterior 2/3 of the tongue? It's the special visceral afferent. Special visceral afferent, and the nucleus is nucleus of tractus solitarius. Nucleus of tractus solitarius. Very good. And fourth, yes, nucleus of tractus. And fourth, the facial nerve also supplies the external ear. It supplies the skin over the external ear. Skin over the external ear. What is the name of the component of this? General somatic afferent. General somatic afferent. General somatic afferent. General sensations from the body wall. Okay, so it carries sensations from the external ear. External ear से facial nerve sensations लेके जाएगा, glossopharyngeal भी लेके जाता है, and the vagus also takes. But finally, all of this would be giving it to the spinal nucleus of trigeminal nerve. Spinal nucleus of trigeminal nerve. So this becomes the. So the facial nerve also carries sensations from the ear, but finally it gives it to the spinal nucleus of trigeminal nerve. And what is this component known as? This component is known as general somatic afferent. Are you clear, bachcho? Are you clear with what are the components of the facial nerve and what are the names of the nucleus belonging to this component? ऐसे याद रखना for any nerve. So you just know what the nerve supplies. Okay, what is the nerve going to supply? फिर उसके components होते हैं, and वो components के nucleus होते हैं. If you remember it like this, it's very clear. So what are the nucleus of facial nerve? One is the motor nucleus of facial nerve, which supplies the muscles of the second pharyngeal arch. Second is the superior salivatory and lacrimatory nucleus, supplies all the glands except parotid. Third, the nucleus of tractus solitarius supplies special sensations to the anterior 2/3. And fourth, general somatic afferent supplies the external ear. Now fibers will come from this nucleus, this nucleus, this nucleus, and now fibers will come from all the nucleus, and the fibers now converge. They now join to form the facial nerve. They now join to facial nerve to form the facial nerve. And where is this facial nerve attached to? It's attached to the pontomedullary junction. The facial nerve is now attached to the pontomedullary junction. अब इसके आगे बोलो, इसके आगे. The facial nerve enters into which foramen? Anyone? Anyone? Answer. Facial nerve enters into which foramen of the skull? Yes, bachcho. General visceral afferent is vagus. General sensations from the viscera is generally vagus. Srav? Yes. Clear? Fine to all of you. So you tell me now, which foramen does the facial nerve enter into? It enters into the internal acoustic meatus. अब जैसे ये internal acoustic meatus के अंदर गया, the facial nerve now goes into which ear? The facial nerve is now into the internal ear. It's now into the internal ear. The facial nerve from the internal now comes into the middle ear cavity and it undergoes a bend. What is that bend known as? Answer this. What is this bend known as? Bend. The bend is known as the genu of the facial nerve. Then it goes above the promontory and undergoes a second bend. What is this? I draw this as the promontory. The facial nerve comes inside the middle ear, undergoes a bend here, that's the genu. It goes above the promontory, undergoes a second bend here, the second genu. It goes behind the promontory and now it finds a foramen here. What is this? This is the stylomastoid foramen. It comes out. It enters into a gland now. ये क्या gland होगा? That's the parotid gland. And now it divides into 5 branches to supply the muscles of facial expression. It supplies the muscles of facial expressions. Is this clear to all of you? So that's the course of facial nerve. The facial nerve undergoes a bend. That bend is known as genu. Now it goes inside the middle ear, undergoes a second bend. That's a second genu, and now gets out to the stylomastoid foramen, enters the parotid gland, and gives 5 branches. What are the branches of facial nerve in the ear? Anyone, if you can answer this, what are the branches of facial nerve in the ear? One is the greater petrosal nerve. Second is the nerve to stapedius, and third is chorda tympani. So greater petrosal nerve, the nerve to stapedius, and chorda tympani. Nerve. Is this clear? Then the rest of the things you know. Okay, I'll come back to this MCQ. So ये MCQ clear है to all of you? So one of the following statement about this nerve false होगा, ये MCQ false. So your answer is C for the C. Okay, fine. I'll come to the next MCQ, students. Next MCQ. Answer this. What is this? Slide. Histological slide. Anyone? What is this histological slide? Anyone? Papilla नहीं है बच्चा. It's not papillae. I'll give one hint. एक hint देता हूँ मैं. You can see this finger-like projections. हाँ, ये finger-like projections देख रहे हो ऐसे. These are the villus. Abhi bolo. These are the villus. Finger-like projections are the villus. So, what do you think is this? Where do you get villi? Very good. Yes. Shashwat, that's right. Villus. Where do you get this villus? My question. Where do you get this villus? Small intestines. Perfect. So this is the slide of small intestine. है ना? This is the slide of small intestines. So villus mila. So this is a slide of small intestines. अब small intestines is of 3 types. है ना? 3 types का है. One is jejunum. One is duodenum. Cancel this. Duodenum. Second is jejunum. And the third is ileum. So duodenum. jejunum and ileum. So these are the three parts of the small intestines. The moment you get this finger-like projections, you identify this as a villus. So it could be either duodenum, jejunum or ileum. So what you get in the duodenum? In the duodenum we get glands in the submucosa. We get glands in the submucosa, and these are known as Brunner's glands. These are known as the Brunner's glands. Yes. So you see villus, and the moment you see Brunner's glands in the submucosa, this is a slide of duodenum. Perfect. I'll show you this. If you get lymphoid follicles, ऐसे गोल lymphoid follicles मिलते हैं. So that in the submucosa. What are these lymphoid follicles known as? Peyer's patches. This lymphoid follicles are known as Peyer's patches. So if you get this lymphoid follicles in the submucosa, that is a slide of ileum. And if you don't get anything specific, you don't get Brunner's glands, you don't get Peyer's patches, nothing specific. That's jejunum. Okay, so duodenum is villus with Brunner's glands. Villus with Peyer's patches is the ileum, and villus with nothing specific, that's a jejunum. That's how you identify the slide of small intestines. And how do you identify large intestine? Bacho, large intestine, you get plenty of goblet cells. You get the simple columnar epithelium, that's fine, and you get plenty of goblet cells. Goblet cells secrete what? Mucus. है ना, ये mucus secrete करते हैं. And you get large number of goblet cells for lubrication. That is large intestine. Clear है ये बच्चों? This is the easiest way to remember and understand this. Look. What are the 4 layers of GIT? ये तो आपको पता होगा. What are the 4 layers of GIT? 1 is the mucosa, 2nd is the submucosa, 3rd muscularis externa, and 4th is the serosa. Clear, students? Mucosa, submucosa, muscularis externa, and serosa. The mucosa is made up of 3 parts. Anyone, can you answer this? If you know, you answer this, students, first. Mucosa is made up of 3 parts. Okay, I'll just write this down for you. So mucosa, then is the submucosa, 3rd is muscularis externa, and 4th is serosa. Okay, so mucosa, submucosa, muscularis externa, and serosa. Okay, quick. Mucosa is made up of 3 parts. What is that? Very good. Epithelium, lamina propria, and muscularis mucosa. Very good. Muscularis mucosa. Epithelium, lamina propria, and muscularis mucosa. Yes. Submucosa is fine. Muscularis externa contains of inner circular and outer longitudinal muscles. Inner circular and outer longitudinal muscles. And the last layer is serosa or adventitia. ठीक है? So these are the layers of GIT. I just quickly told you. C is a mucosa, submucosa, muscularis externa, and serosa. Mucosa is made up of epithelium, the lamina propria, and the muscularis mucosa. And students, this muscularis mucosa is a characteristic of GIT. It will be present in the entire GIT. The muscularis mucosa. Fine. So I hope this is clear to all of you. Yes, slide is clear. So this is the duodenum. You get villus, and what are these glands here? These are the Brunner's glands, the submucosal glands. These are the Brunner's glands. Perfect. And you can see this. This is the this is the muscularis mucosa. ये line देखिए. This line is very prominent, and this line will be present throughout the GIT. That's muscularis mucosa. Perfect. Okay. Now, one moment. Now, which other things? Now. If you can identify this slide. Okay, students, identify this pointed structure. Anyone? Identify this pointed structure. Chalo, you tell me what view is this? कहाँ से देख रहे हो and what is this structure? Anyone? Very good. That's internal thoracic artery. कहाँ से देख रहे हो? Which wall of the thorax is this? I want you to understand this. Which wall of the thoracic is this? Which wall? Anterior wall or posterior wall? Which wall of the thorax? It says the anterior wall of thorax. We are looking from inside. अंदर से देख रहे हो. Anterior wall of thorax. We are looking from inside the thorax. है ना? अंदर से देख रहे हो. Right. What is this artery? Anyone? What is this artery going to be? एक मिनट, I'll just magnify this. Okay. What is this artery going to be? Answer, students. This artery. This artery is the subclavian artery. Subclavian artery. And what is this artery? This is the internal thoracic artery. Internal thoracic artery. So internal thoracic artery is a branch of the first part of subclavian artery. Take it now. Internal thoracic artery is a branch of first part of the subclavian artery. It runs on either sides of the sternum. At the sixth intercostal space, it divides into two branches. Can anyone answer this? What are these two branches of internal thoracic artery? One. What is this and what is this branch? Chalo, what is A and what is B? Anyone? So internal thoracic artery divides into two terminal branches. What is A? Come on, bacho, be interactive. Come on, answer. Even if it is wrong, it's okay. There's nothing to worry about. Excellent. This is the superior epigastric artery. A is the superior epigastric artery and the B artery is going to supply the muscles and it supplies the diaphragm. It is therefore known as the musculophrenic artery. Musculophrenic artery. I'll just write this for you. Yes. Superior epigastric and musculophrenic. Very good, bacho. So internal thoracic artery. Kya hua? Internal thoracic artery. I'll write it here. Internal thoracic artery. It's a branch of first part of the subclavian artery. It divides into a superior epigastric and the second artery is musculophrenic. Superior epigastric and musculophrenic. What happens to the superior epigastric artery? Anyone? This superior epigastric artery passes through foramen of Morgagni. It passes through the foramen of Morgagni, enters the rectus sheath, anastomoses with the inferior epigastric artery, which is a branch of external iliac. It's a branch of external iliac. So superior epigastric artery anastomoses with the inferior epigastric artery, which is a branch of external iliac. Clear to all of you? Is this clear? So superior epigastric artery is a branch of internal thoracic artery. Where is this branch given? In the thorax. How does this superior epigastric artery enters the abdomen? आगे ना diaphragm में, if you see anteriorly, there's a small gap in the diaphragm. There's a small opening in the diaphragm. What is that opening? Known as foramen of Morgagni. Foramen of Morgagni. And what passes through this foramen of Morgagni? The superior epigastric artery. It enters the rectus sheath. It anastomoses with the inferior epigastric artery, which is a branch of external iliac. Just remember this. Very important. Very important. ये inferior epigastric artery कहीं पे सुना आपने? Inferior epigastric artery. Have you heard this somewhere? Inferior epigastric artery. Can you quickly tell me where have you come across inferior epigastric artery? One. बोलो. बोलो बच्चों, बोलो. Inferior epigastric artery. Very important. Very important. Inferior epigastric artery. हाँ, very good, very good. It forms the lateral boundary of, yes students, it forms the lateral boundary of Hasselbalch's triangle. Perfect, perfect, very good बच्चों. तो ये है rectus abdominis, ये है inguinal canal. This is the superficial ring, that's the inguinal canal, that's a deep ring. And what is this artery here? That's the inferior epigastric artery. Very good. So inferior epigastric artery forms the lateral boundary of Hasselbalch's triangle. This inferior epigastric artery is going to differentiate between two hernias. बोल सकते हो? If a hernia comes from here, from this deep ring, अगर hernia deep ring से आता है, what is that hernia known as? Indirect. And if a hernia comes through this Hasselbalch's triangle, what is that hernia known as? Direct hernia. That's a direct hernia. So inferior epigastric artery के 3-4 points which you should know. Forms the lateral boundary of Hasselbalch's triangle, differentiates between a direct and an indirect inguinal hernia. Very good. This inferior epigastric artery, someone is going to wind around it. Someone is going to hook around it. ऐसे it is going to wind around it. कौन होगा? Someone is going to wind around the inferior epigastric artery. Come on, बच्चों, come on, answer. Who's that? Answer. Someone is going to wind around the inferior epigastric artery. Different in males, different in females. Abhi bolo, I've given you a hint. In males, who's that? In males. नहीं, गैस करो ना बच्चों, गैस. ओके, क्या बोलो? Conjoined tendon. नहीं, it's vast difference. Very good, it's vast difference. बच्चा, it's vast difference. Yes, you got it right. Spermatic cord भी नहीं, it's vast difference. Specifically, spermatic cord is a group, no? Madhavan, spermatic cord is not a single structure, it's a bunch of structures which is packed together. That's spermatic cord. It's a bunch of structures. Out of this, look, ये testis है. I'll just make this as testis, and what would continue from here? That would be the vas deferens. The vas deferens will be passing through the inguinal canal. It enters through the deep ring. But this vas deferens has to come here. Where is the bladder? Here, and bladder is on the medial aspect. So this vas deferens is going to wind around the inferior epigastric artery and come towards the bladder. It is going to wind around the inferior epigastric artery and come towards the base of the bladder. So that's the inferior epigastric artery. Okay, who winds around it? The vas deferens in males, females में बोलो. In females, who winds? In females, who winds around the inferior epigastric artery? Come on, बच्चों, come on. In females, it's the answer before I tell. Males में vas deferens, females में round ligament of uterus. Round ligament of uterus. Okay. In females, who winds around the inferior epigastric artery is the round ligament of uterus. And this inferior epigastric artery gives a branch. ये inferior epigastric artery के दो branches है. So I've told you how many points about the inferior epigastric artery. One, forms the lateral boundary of, I'll just jot this down for you, forms the lateral boundary of, yes, very good, Hasselbalch's triangle, forms the lateral boundary of Hasselbalch's triangle, differentiates between direct and indirect, differentiates between a direct and indirect inguinal hernia, direct and indirect inguinal hernia. Third, the vas deferens and a round ligament winds around it. So I'm just jotting down the points for you. Winds around it. So vas deferens in males and the round ligament of uterus in females winds around the inferior epigastric artery, and it has two branches. कोई बोल सकता है what are the branches of inferior epigastric artery? 1 and 2. Come on, students, come on. 1. Branches of inferior epigastric artery. 1 is the cremasteric artery. Cremasteric artery. ये कहाँ होती है cremasteric artery? Where is the cremasteric artery located? Anyone? Anyone? Cremasteric artery, cremasteric artery, cremasteric artery. Bolo na. You can guess. One branch is cremasteric artery. It is a content of spermatic cord. It lies within the spermatic cord, the cremasteric artery. That's a branch of inferior epigastric artery. It lies inside the spermatic cord. And the second one is abnormal obturator artery. Cremasteric artery, it's a content of the spermatic cord. And the abnormal obturator artery. Tell me, where does this lie? Abnormal obturator artery, where does this lie? Anyone? This you should know, bachcho. This you should know. Bolo na, bolo, jaldi. Where does this abnormal obturator artery lie? Nahi. In between external oblique and transverse abdominis, nahi bacha, nahi. Abnormal obturator artery, where does this lie? I'll give you a hint. Hint deta. This is important for femoral hernias. Abhi bolo. ये abnormal obturator artery का importance is in femoral hernia. In femoral hernia. Anyone? Now I'll have to tell you the femoral hernia, femoral part. Jaldi bolo na if you know. Nahi, you're not able to recollect. Pacha, you're not able to recollect. Okay, I'll help you out. It's no problem. I'll help you out. I'll help you. Near the ring. Arjun is coming close now. Arjun is coming close. Yes. Close to the answer. Huh? Yes, Arjun is coming close to the answer. Ek minute. Quickly tell me, what is this that I'm drawing? This is the femoral sheath. ये femoral sheath मैंने draw किया. Femoral sheath. What are the compartments of the femoral sheath? एक होता है lateral compartment, एक होता है intermediate compartment, and one is the medial compartment. ठीक है ना? Lateral, intermediate and medial. Who's there in the lateral compartment? में femoral artery होती है plus the femoral branch of genitofemoral nerve. Femoral artery and the femoral branch of genitofemoral nerve. In the intermediate compartment is the femoral vein. And the medial compartment is known as femoral canal. Medial compartment is known as femoral canal. The upper part of the femoral canal is known as, what is this? Abhi bolo. The upper part of the femoral canal is known as the femoral ring. Isko bolte hain femoral ring. Okay. This is known as the femoral ring. And what are the boundaries of femoral ring? Boundaries. You're following the students ke difficult lag raha hai. This is 1, this is 2, this is 3 and this is 4. ये 4 boundaries होती है femoral ring के. So the femoral sheath is made up, the femoral sheath has 3 compartments. I'm just telling you to the point. The lateral compartment, the intermediate and the medial compartment. Who lies in the lateral compartment? The femoral artery and the femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. Intermediate compartment में कौन होता है? Femoral vein. And the medial compartment is empty. It is known as the femoral canal. Femoral canal. The upper part, बच्चों, the upper part of femoral canal is known as the femoral ring. Femoral ring. Okay. What are the boundaries of femoral ring? 1. What is that 1 that I've written? This you have to know. Inguinal ligament. This is a very important MCQ for you, bachcho. Inguinal ligament, also known as yes, that's fine. Inguinal ligament is also known as Popart's ligament. Inguinal ligament is also known as the Popart's ligament. Second is lacunar ligament. The other name for lacunar ligament is Gimbernat's ligament. Very important, bachcho, very important. Medially is the lacunar ligament or the Gimbernat's ligament. Posteriorly, ये anterior है, ये anterior है. Number 1 inguinal ligament, medial is number 2, ये लिखा नहीं मैंने, medial is number 2 lacunar ligament, posterior is number 3, that's pectinate ligament. Pectinate ligament का दूसरा नाम है Cooper's ligament. And the last laterally is number 4, that is a septum, separating it from femoral vein. So septum separating it from the femoral vein. So these are the boundaries of the femoral ring. Femoral ring के boundaries, anteriorly inguinal ligament, ये turn is medial is lacunar ligament, posterior is the pectinate ligament, and laterally is the septum separating it from the femoral vein. This femoral ring contains a lymph node. What is this lymph node known as? This is the lymph node of Cloquet. See, बहुत MCQs मैंने बोला आपको, बहुत important topics I've told you now in this 1 hour. Lymph node of Cloquet or Rosenmuller. So this is lymph node of Cloquet or Rosenmuller. Okay, and what is this lymph node drain, bachcho? What is this lymph node drain? Another MCQ for you. This lymph node drains the glans penis. Drains glans penis and glans clitoris. Yes, it is known as the lymph node of Cloquet. The femoral ring के ऊपर there's a lymph node. That's a lymph node of Cloquet or Rosenmuller. And what does it drain? The glans penis and the glans clitoris. Okay. Now why is this femoral canal so important? इसमें ना femoral hernia हो जाता है. And when there's a femoral hernia, you have to reduce the hernia. अब hernia reduce करने के लिए you have to dilate the femoral ring. है ना? You have to make this femoral ring wide. And to make the femoral ring wider, you have to cut something. What do you cut, students? What do you cut? The lacunar ligament. We cut the lacunar ligament, we dilate the femoral ring and we push the hernia upwards. है ना? A femoral hernia comes like this. Through this femoral ring it comes down. Right? That's a femoral hernia. So reduce करने के लिए, femoral hernia, to reduce it, we have to cut the femoral ring. Now which boundary of femoral ring do we cut? Which boundary do we cut? The medial boundary. We cut the lacunar ligament. We cut the lacunar ligament, we dilate the femoral ring, we reduce the hernia, अब we put a mesh डाल देते हैं. Fine students, this is fine, this is absolutely fine. But sometimes there's an artery which lies on the lacunar ligament. There's an artery, bachcho, which lies on the lacunar ligament, and this artery is the abnormal obturator artery. देखो कहां से कहां गए हम. Understand? So normally you cut the lacunar ligament, that's fine, but sometimes, rarely, there's an abnormal obturator artery which lies on the lacunar ligament, and if we cut this, it leads to hemorrhage. And this abnormal obturator artery is a branch of inferior epigastric artery. Okay, abnormal obturator artery is a branch of inferior epigastric artery. Are you clear with this? Now before I proceed, I'll just brief you about our platform, and then we proceed forwards. Okay, I'll just brief you about our platform. Now students, look, we've got a plus subscription, students, in which there is daily live and access to both live and recorded classes, learning from the top educators, live quizzes, study from the device of your choice, access to over 25,000 plus questions from the bank. And students, now we are coming up with printed notes for our 12 months and plus subscription students, an added advantage for you. An iconic subscription where you get the best of Unacademy and pre-planner. Some special class features in which there are daily live classes, interactive classes they are, polls for the learners, raise a hand technique, never miss a class with proper notifications being given, lecture notes you'll get, and anytime, anywhere you can access the class and get your doubts solved. Okay. A highly effective and updated question bank has been specially prepared for you with detailed explanatory answers. Specially for you. Now boost your medical preparation, bacho, with 24 months, that's 2 years, you get 4 months of subscription free, and with 1 year, that's 12 months, you get 2 months of subscription free. Right? Now students, exam day, a big day for you all. The FMG students, there's a free grand test for you. This Sunday, the 31st of October, 10 a.m. to 1 p.m. with over 300 MCQs. It's a free grand test. Students, pass this message to your friends, your colleagues. Give this exam. It's a free test. Let's crack it, bacho. Let's crack this exam. Okay, so 31st of October, remember, Sunday, 10 to 1, 300 MCQs. Raise a hand technique, in which there's a small icon in your app. If you press this icon, you can directly talk to me or any of the educator. Right? Now students, these are our toppers in the recent NEET PG. They have got excellent marks, good ranks. We congratulate all of them. And students, we have already started with these 2 new batches, and download the NEET PG subscription, subscribe to this. Okay, so students, is this clear to all of you? Right, now any doubts you have in that MCQ, femoral artery MCQ, is this clear to all of you? So I just told you the branches of inferior epigastric artery. Clear to all of you? The branches of inferior epigastric artery are 2. One is the cremasteric artery, and the second one is abnormal obturator artery. Okay? Any doubts? The session is open for doubts. If you have any doubts, you can ask me, or I'll show you one more MCQ. Otherwise, one more clinical MCQ. Okay, one more thing I'll show you. Just identify this pointed structure. Chalo, the last MCQ. Identify this pointed structure. The one in yellow, yellow, not the red. The yellow, pointed structure. Okay, I've made it a full screen. Bacha nahi. Medner. No. It's not Vegas. Bacha, it's not. Yeah. It's Vegas, sorry. It's Vegas. It's Vegas. And what is this nerve? Yeah. What is this nerve? So this is the vagus nerve, which goes behind the hilum. Correct. And what is this nerve in front of the hilum, bacho, which are marked? Yes, Medner and Banu. Which is this nerve which are marked with the that's phrenic nerve. Phrenic. Very good. That's the phrenic nerve. So phrenic nerve is in front of the hilum. Vagus is behind the hilum. Very good. Medner. Yes. Vagus is behind the hilum. Along with the phrenic, you get an artery. Bol sakte ho? Along with the phrenic nerve, which is the artery, that's the pericardiophrenic artery. Pericardiophrenic artery. But so if you can quickly tell me the root value of phrenic nerve. Root value of phrenic nerve. Anyone? Come on. Root value of phrenic nerve. Root value of phrenic nerve. Children. This you should know. Root value of phrenic nerve. C3, C4, C5. C3, C4, C5. Very good. And there's an extra nerve. Extra phrenic nerve. What is that? Accessory phrenic nerve. Uska root value? Phrenic nerve is C3, C4, C5. Very good. And there's an extra nerve which is known as the accessory phrenic nerve. Uska root value is C5, root of the brachial plexus. Okay, so C3, C4, C5 is the main phrenic, and C5 is the accessory phrenic nerve. Okay, this phrenic nerve lies on a muscle in the neck. In the neck, it lies on a muscle. If you can tell me that muscle. Agar ye sab pata hai na, to the moment you get a visual slide, you will immediately able to identify it. Which is that nerve? Which is the muscle on which the phrenic nerve lies? Yes, bacho? Which is the muscle? Scalenus anterior. Very good. It lies on the scalenus anterior. So, main phrenic nerve, C3, C4, C5. Accessory phrenic nerve, C5. The phrenic nerve lies on the muscle, that's the scalenus anterior. And sternocleidomastoid nahi bacha, scalenus anterior. This is extremely important. The phrenic nerve lies on the scalenus anterior, and the phrenic nerve is plastered to the scalenus anterior. अगर ये scalenus anterior है, ये phrenic nerve है, the phrenic nerve is plastered to the scalenus anterior by this fascia. What is this fascia? Prevertebral fascia, by the prevertebral fascia. Okay, so the phrenic nerve is attached to the scalenus anterior. It is plastered to the scalenus anterior by the prevertebral fascia. Okay, students, I hope everything is clear. Thank you to all of you. It was a wonderful session, a very interactive session. And in this session of 1 hour, bacho, I have told you plenty of things which are all extremely important for you. Okay, just have a look at it once again later when you have time and try to recollect things, reconcile things. Everything was an MCQ in its own. Okay, thank you to all of you, my dear children. Thank you and God bless you. Thank you to all of you. Thank you.